I personally think it is really an exciting time to be in the field of pathology. The impact of pathology, while not very publicly visible, is something that I think is going to be increasingly apparent to not only the clinicians but also the patients over the next decade or so. I think we are really at the forefront of the implementation and delivery of personalized medicine.
Before you can treat a disease, you have to understand it and be able to diagnose it. And that's what pathologists do. We're intimately involved with the diagnosis of disease. And pathologists are an integral part of the healthcare team. Every single day, when I'm looking at patient slides, I'm either talking to a patient or most likely I'm talking to their doctor, and I'm explaining to their oncologist or their other treating physician exactly what I'm seeing and what that means for the patient. Most patients don't hear about pathologists, and maybe that's a good thing, but when you really need it, we're here. We're the experts.
Many times people think of pathologists as hiding in a basement, but actually we're very engaged in patient care as well.
When I was initially thinking about going into pathology, and I was thinking about it in med school, I couldn't have imagined how satisfied I would be with what I was doing in my work. This is just a dream for me, because to me it's the perfect hybrid of my interest in laboratory medicine and laboratory science, but importantly applying it directly to a patient and being able to see that come to fruition for a patient's care and be working with them in this is a dream come true.
During a surgery, if a surgeon comes across some unexpected finding, or they need to know a result right then and there when the patient is in the OR, because that will tell them how the rest of the surgery will go, they send it out to us in our laboratory right outside the door to perform a very rapid test to give them an answer. And we shoot to get that done within 20 minutes, which we mostly do.
We cannot do our work without the clinical pathology team. Without them, we're not able to tell if we have normal margins around a tissue specimen in the operating room. They'll actually do frozen sections for us, which will tell us if we need to take more tissue or do a different type of resection. So literally, they are absolutely critical. We can't do what we do in oncology without our pathology team.
It's actually pathologists who personalize medicine, and we do that by looking at the genetic features of the patient, and in the case of oncology and cancer care, actually analyzing the cancer itself.
We have been the primary providers of molecular pathology care here in the state of New Mexico. Over the past 1 year, we have been at the forefront of introducing what is known as a next-generation sequencing assay, which enables pathologists and doctors to examine multiple genes in a tailored and individualized fashion at a single setting. This technology was not available even a year ago, and we were actually the first people in the state of New Mexico to introduce this here for the patient population.
The interaction between UNM Pathology, Tri-Core Reference Labs, as well as the other facilities throughout the state of New Mexico is truly what makes UNM Pathology, and specifically the Clinical Microbiology Laboratory, unique. So in our Clinical Microbiology Laboratory, we see anywhere from about 75 to 85% of the specimens that have clinical microbiology laboratory testing come into this laboratory for the entire state of New Mexico. That means we have a huge volume of information and knowledge about the infections, infection rates, about health, about antimicrobial resistance that's happening across the state of New Mexico. There's really no other place that has that and has that access to the type of data that we have. The other distinguishing factor in the laboratory is that it's such a collaborative environment, that we can utilize each other's expertise to further our own new research endeavors. So as I'm starting to look at next generation sequencing for microbial specimens, I can talk to our collaborators who've been doing it for oncology diagnosis and gain their expertise and their experience to further my own research. And that's an environment that doesn't always happen, but it's very present here.
We have a very broad faculty in terms of experience. These faculty could be anywhere. They choose to come to New Mexico. This is a place where they want to be. University of New Mexico has a long history of collaboration as well as having excellence in medical education. And you have an opportunity to explore that here.
Our program builds on the skills that our trainees came with from medical school and further develops that in the role of a clinical consultant. We enjoy each other and we enjoy the work we do, and I think this makes a really positive training environment for our trainees.
Our goal at the University of New Mexico is to really train pathologists for the future. We want pathologists to understand emerging trends in pathology informatics, digital imaging, and molecular diagnostics, and we bring all of those together here at the University of New Mexico.